So in winter time they've got less daylight hours, so people tend to be less active, stay home more, maybe be tempted to eat more. So with the cold weather we might see our sugars rise. So the ways to combat that is by making sure we do keep active, we do sort of rug up, go outside and do what we enjoy, whether it's playing golf, going for walks on the beach, round rail trail, whatever it is, going to the footy with the family. Just make sure we're keeping active. That incidental exercise will help keep our blood sugars lower. Also with eating, it's a good time to maybe do some nice cooking. Great time for big vegetable soups and stews and things like that, which will also help lower our blood sugar rather than the quick fast food options out there to keep us warm. So yeah, keep active and keep doing what you like. Maybe it's an opportunity to try new things. Maybe try the Colac indoor pool or the Cobden indoor pool if you want a nice warm activity. So even shopping and housework, they're good ways to keep active as well in winter. If you do notice your blood sugars continue to rise, that's when it's time to contact your GP or diabetes educator, and we might be able to modify your medication and help you with that. We also have the exercise physiologist here, so if you feel like you're not as active as you would like to be, or you've got restrictions, you've got sore shoulders, sore knees, things like that, see your GP for a care plan, and James can provide an exercise program. It doesn't have to be very active. You can have chair-based exercise programs that will help you. Winter time is time we should make sure we're keeping healthy. So if you haven't had your flu vaccination, it's a great time to book in. Also, if you have COVID-19, you may see fluctuations in your blood sugar levels. So again, make sure your doctor knows that you've got a COVID diagnosis and you might have to monitor your blood sugars more frequently. You're also going to make sure your blood sugar is not going too low. So you could feel shivery and shaky, and that could actually be a result of a low blood sugar. So it's important that you have your hypo kit, that you have your fast acting glucose so you can rectify. And if you're feeling unwell, test more frequently. Make sure you stay hydrated as well. In winter, also your diabetes equipment, we've got lots of new technologies. We've got sensors like this that people wear on their body, and it's important that they're kept warm. So if you're lucky enough to go off skiing or you're outside a lot, just make sure they're kept warm. And you might want to keep your meter in your pocket, especially if you're a type 1. The batteries need to be kept warm as well. If you're having any difficulties with the technologies, just contact the companies and they will help you as well. Winter time and the change in seasons is also a common time for new type 1 diagnosis to occur. So the 4 things to remember are toilet, thirsty, tired and thinner. So if you notice you're losing weight, or especially young children, if they're losing weight, if they're going to the toilet more frequently, they have an uncontrollable thirst, and really lethargic, make sure you see your GP or go to your nearest hospital and have their blood sugar taken and checked out. So basically in winter, keep warm, keep active and continue to do what you enjoy, and don't hesitate to ask for help.